Alrighty, welcome to the first content lecture for learning module number 1, titled State of the Nation. And when we're looking at physical education curriculum and programs, we have to take in several factors, whether it's student interest or motivation, community values, all of these things play a role. But one of the things that probably plays a huge role right now is current issues in our society, such as the obesity pandemic, which most of you are probably aware of, unless you've been living underneath a rock. So with this lecture, what we're going to do is we're going to look at some of the data from the CDC that's based off the Behavioral Risk Factor Surveillance System. These are really cool PowerPoints that you can download from the CDC and use for advocacy or education purposes. All right, so before we get looking at these different maps and data pieces, we first have to kind of define what is obesity. And so obesity is going to be defined as a person having a body mass index of 30 or higher. And body mass index is essentially a calculation based off your weight and your height. And it's one that I know many of you are already moaning about because a lot of athletes sometimes are categorized with having a high BMI number, when in actuality they actually have a lower body fat percentage. But for the general population, this is actually a pretty good number to use. The advantage of using it too is that we actually have data on this for quite some time. So longitudinally, we are able to look at trends of obesity across our country. And that's what we're going to be doing with these maps. We're going to be looking at the years from 1985 through 2010. So let me just kind of explain how these maps are going to work. Down here in our little key, we've got no data for any of the states that are currently white. They just didn't partake in the surveillance system, so we just don't have any data for them. States that have some sort of coloring to them, though, indicate the percentage of the population of that state that's being categorized as obese, meaning a BMI of 30 or higher. So currently, right now, let's look at North Dakota in 1985. People are rocking out to their medal bands. 10 to 14% of the North Dakota population was considered obese. All right. As we go forward, I apologize, this little key down here gets a little bit skewed, so I will just kind of announce what the colors represent as we go along. So heading forward, 1986, 1987, 88, 89, we see that more and more states are participating in the data collection, and we see that some of the lighter blue states are turning towards that medium blue color. Going forward, 1990, 1991, we're getting into that grunge area. We've got some of the bluer states here showing up. Mississippi, Louisiana, West Virginia, Michigan. They are now reporting a prevalence of obesity in their state of 15 to 19%. Moving forward, 92, 93, 94, 95, 96, 1997. We've had, let's go back, 1997. We've had to increase our color coding system. So now we've got beige representing states that have a prevalence of obesity that is 20% or higher. Moving forward, 1998, 99, 2000, 2001. We have to add another category, Mississippi. Essentially, they've got 1 in 4 people in their population being categorized as obese. You'll also notice that the other states keep progressing forward in the trend, having higher percentages of people being categorized as obese as well. Colorado, holding out. All right, here we go. 2002, got a couple more orange states. Colorado couldn't resist anymore, and they went up to the next category there. 2003, 2004, 2005. Now we've got to add yet another category. Red states are now representing populations with a 30% or more prevalence of obesity in their population. 2006, 2007, 2008, 2009, and 2010. And what we can see is that there's quite a density here in the South regarding the worst category of 30% or more prevalence of obesity. So let's just kind of summarize what we just saw happen as we traveled through time. In 1990, among the states participating in the Behavioral Risk Factor Surveillance System, 10 states had a prevalence of obesity that was less than 10%, and no state had a prevalence equal to or greater than 15%. So that wasn't too bad. We move on to the year 2000, and no state had a prevalence of obesity less than 10%. 23 of the states had a prevalence between 20 and 24%, but no state had prevalence equal to or greater than 25%. And then as we move 10 years down the road to 2010, we now see that not a single state has a prevalence of obesity that's less than 20%. We've completely wiped out all the blue coding. Now we also have 36 states with a prevalence equal to or greater than 25%, of which 12 of those states, Alabama, Arkansas, Kentucky, Louisiana, Michigan, Mississippi, Missouri, Oklahoma, South Carolina, Tennessee, Texas, and West Virginia, had a prevalence of 30% or more. In addition to the fact that we have our obesity trends are increasing, we also have found that physical inactivity is also increasing. So amongst adults, this is 2008, again, this is data from the CDC, we see that, oops, let's go back. Sorry about that. We see, here we go. We see that states, particularly in the South, again, they're showing inactivity at rates of 32.6%. So they're physically inactive, not really doing anything besides daily activity in regards to going to work, going to school, getting in the cars, and whatnot. Okay. We see that the West Coast doing pretty well, New England doing pretty well. I love that Minnesota's rocking it, okay, the lowest category here. It's interesting to look at North Dakota. There are quite a few different patches here. Maybe Fargo is maybe holding out with only 20 to 24% of the population being physically inactive. Okay. So we were just looking at data with adults. So what about children? Well, what we know so far is that approximately 17% of our nation's children and adolescents are currently obese, and approximately 1 in 3 are overweight. And this is really disturbing because essentially obesity has tripled since 1980 for this age group. And unfortunately, if a child is overweight or obese, they are more than likely to become a overweight or obese adult, which brings on multiple problems that we're going to discuss here. So the physical activity guidelines for Americans is put out by the U.S. Department of Health and Human Services. And what they recommend currently, the 2008 is the most recent guidelines, is that children get 60 minutes or more of physical activity each day. And it should be of a moderate or vigorous intensity level if it's going to be an aerobic workout. The vigorous intensity should occur at least 3 days a week. Muscle strengthening should also be occurring with these children, as well as bone strengthening for at least 3 days a week. And what they know is that most children are not meeting the guidelines. So, for example, only 18% of students in grades 9 through 12 met this recommendation in the year 2007. So we have not only physical activity amongst our adults, but also with our nation's youth. Overweight and obesity-related health problems are numerous. You can see that we've got two different categories here. We've got it for adults being overweight and obese. These are risks that are associated with that. With children, it doesn't list overweight, it just simply lists obese children. And let's just take a look at some of these. So with obese children, they've got increased risk of glucose tolerance. We're seeing more and more cases of type 2 diabetes showing up in children. Let's see, breathing problems such as sleep apnea and asthma. So sleep apnea is when they kind of stop breathing. They've got joint problems. So, kids who are obese, sometimes they complain that when they're running, it hurts. And a lot of times they're telling the truth because their joints actually are in pain from carrying around the extra weight. And of course, these children are kind of at greater risk for social and psychological problems, such as discrimination, poor self-esteem, and this can lead into adulthood. Again, a child who's overweight, obese, is likely to become an overweight or obese adult as well. And then they are more susceptible to other problems, such as gynecological problems, infertility issues, liver and gallbladder disease. They're more at risk for certain types of cancer, such as endometrial, breast, and colon cancer. And so it just wreaks havoc with your whole system. Now, why should everybody care about this besides the fact that we have people that aren't healthy? This is going to have a huge impact on our healthcare in this country and the costs associated with it. We're talking billions and billions of dollars here. So physical activity has sometimes been referred to as the miracle drug or the wonder drug, and it's because there's so many benefits to it. Now, health-wise, this is why I care a lot about children being physically active, is that there's lots of health benefits. When you talk to principals or teachers, classroom teachers, a lot of times they are more concerned with children's physical activity because it can help improve academic performance and it can also minimize behavior issues. Whatever, the reason that people want to care about children's physical activity is fine by me. And you kind of have to know your audience when you are, trying to get them to drink the Kool-Aid. So we may want kids to be active for health benefits, but we might need to sell physical activity for its other benefits. But let's take a closer look here at the health benefits of physical activity. Within children and adolescents, there's strong evidence, and this is put out again by the U.S. Department of Health and Human Services, but strong evidence that it improves cardiorespiratory muscular fitness, improves their bone health, can have favorable body composition as a result. There's moderate evidence in the research that shows that it can reduce symptoms of depression. Wouldn't that be nice if kids could just exercise instead of being put on antidepressants? With adults and older adults, there's been a lot more research, and so we know and see that there's stronger evidence that it can lower the risk of early death. Physical activity can help prevent weight gain, can lower the risk of certain types of cancers, lower the risk of type 2 diabetes. There's moderate to strong evidence in the research that it will reduce abdominal obesity, which is right around the waistline, so people get into apple shape. And there's a little bit of evidence showing that people who are being physically active might be less risk for things like falls and having hip fractures, lung cancer, and it can also help with maybe some sleep quality. So lots of benefits here for physical activity. Pretty awesome. Again, I'd already kind of mentioned talking about different stakeholders and why they might be invested in children being physically active. And it could be, because they're concerned about academic performance or they're looking at behavior. So you're going to read a little bit about those in some of the articles that I have posted and some of the videos that you'll watch. So that concludes our very first lecture. This is Go Patriots. I can't believe we just signed Tim Tebow. I don't know what we're doing with him. Maybe we'll make him a running back. But I'll sign off for now, and you can keep progressing through the learning module. Take care.